Hello, this is Dr. Jaydeep Chaudhary with Academics in Nutshell. As a physician and more so as a pediatrician, sometimes we have to convey a very difficult bad news to the parents. Now, a bad news is a message which has the potential to shatter hopes and dreams, leading to a very different lifestyle and future for the family members and more so for the parents. But as a communicator, we must realize that a bad news cannot be converted to a good news. The few skills that are required for a physician and a pediatrician to convey are a complex communication skill, a verbal and non-verbal, both together. It can create a serious miscommunication regarding prognosis of illness or the purpose of care if not done properly. And a poorly delivered bad news, the experience may stay in the mind long after to the family members. So what the parents want, they want some additional information. They want to know whether there is any chance of cure, the side effects of therapy, a realistic estimate of recovery. So the parents wants the doctor to be honest, compassionate, caring, and of course hopeful and informative. The 6-step protocol for breaking a bad news, number one is to get it started, that where the hesitation lies. Then finding out how much the parent knows, how much the parents want to know. Then the sharing of information, responding to the parents' feelings, and ultimately planning and follow through. Some statements may be very unhelpful in communication. That is, like, it could be words, we all die, I understand how we feel, and nothing more can be done. So these are very, very unhelpful statements. A situation may arise when the parent starts to cry. We have to wait for the person to stop crying, take a break, and then again start, but we must not run out of the room. The things may go wrong if we try to escape. If we try to react in anger, that may create a lot of difficult situation. And if we dilute the agenda with some other things like billing or some distraction like that. Now, this conveying a bad news often has a very grave impact on the health of the healthcare professional also, because it can be extremely stressful, and the bearer of the bad news experiences a strong emotion like anxiety, the burden of responsibility, and the fear of negative response. So as a pediatrician, as a caretaker of the children, and as a communicator, we have to be very careful in dealing with bad news. Thank you.